So what do we mean by integrated care? In my mind, it's best thought of as a framework rather than as a thing. It's a framework that draws together many strands of what health systems have been thinking about for the last 10 to 15 years. And essentially, it represents a shift from, if you like, a hospital emergency department, which deals with whatever comes in through the door and is ready for whatever comes in through the door. It's essentially episodic, it's reactive, and it's ad hoc, and we're really fortunate to have it there in that role. But this is a deliberate attempt to shift the system to much more of a planned and structured proactive care model. It's not just about changing the hospital, it's most importantly about changing what happens in primary and community services to get them to operate in much more of a planned and structured and proactive way in order to manage demand elsewhere in the system. So the drivers for an interest in integrated care are many, but they can really be boiled down to a desire to improve the quality of the patient experience and outcomes, and also acute demand management. In other words, trying to reduce the pressure on the hospitals, and that's the immediate focus that everybody has. From a patient perspective, integrated care is all about service coordination and trying to improve the patient experience. So when patients experience a fragmented system, they know it. They're the ones who experience it. It's much harder for patients to define what an integrated system looks like, but again, they'll know it when they experience it. And for those of you who are interested in this dimension, the NHS in England is doing a lot of work through a program called Patient Voices on trying to have outcome measures that are related to the patient experience. They call it I statements, as in the letter I. In other words, these are statements about me and my care, and that those statements should drive how the system works. So if we're going to do this kind of fundamental reorganisation of the health system to operate in a more integrated manner, it requires action at all levels of the system. At the micro level, so about operational integration between health professionals, at a meso level between organisations, and then at a macro level across the system as a whole. Generally speaking, because of constrained funding, the shift to integrated care needs to happen within existing resources, and it needs to be a new way for the existing players in the system to work. New South Wales has decided to put some seed funding into integrated care, and most systems end up doing that, but it's usually for a finite period in order to trigger some change. It's not part of injecting another whole layer of people and money into a system and calling it integrated care. So this is about re-engineering the existing system. The extreme end of this, you can look at, again, NHS England at the moment. They are creating something called the Better Care Fund. How are they creating it? Well, they're doing this by top slicing funding out of the system. They're going to take 15% of funding out, and then organisations can reapply for their money, and it's going to come with a whole lot of strings attached to it. It's a pretty brutal way of bringing about change, but the NHS in England is driven by some pretty strong financial imperatives at the moment. It was also very interesting going to this international conference and seeing the extent to which almost all health systems in developed countries are now working on integrated care initiatives. This is the next big thing in health without any question at all. I apologise in advance for using terms like old and new. It's really, this is a slide that is intended to point to some areas in which the new models of integrated care can be thought of as different from the traditional way in which health systems have operated. It's decentralised, it's generalist-led rather than specialist-led. Heavy emphasis on self-management and empowering patients as opposed to a professionally led system. It's about teamwork rather than siloed professional groups. It's about patients rather than providers. It's about quality of life rather than quality of care. It's about health behaviours rather than diagnosis and treatment of disease, and it's got an emphasis on delivery of care in a community setting rather than in hospitals. Now, you'll look at this list and think, well, there's nothing new there, is there? And there isn't. As I say, integrated care really is drawing together a whole lot of strands and trends that have been going on anyway over the last decade. And they're now being drawn together into a more coherent package that's being titled integrated care.